All right, hello guys. All right, so I'm gonna be talking a little bit about the squat today, just a little follow up from all their squat little assignments that we've had. Okay, so one thing a lot of people have messed up is, does the knees go over the toes when they squat? Okay, some people said yes, some people said no. Ideally, the answer is yes, and I'll tell you why. A lot of people say no, they shouldn't. So one, you do need the knees to pass over the toes when you squat. So that allows your center of gravity to shift forward more. That way we're not falling back as we squat. Okay, a lot of that requires a lot of ankle mobility as we do it, but your knees do have to go over your toes a little bit. Yes, they have to be in line, where the knees pointed out a little bit, same with their feet, but they do need to go over. So a lot of times we hear they shouldn't go over the knees is usually from a rehab perspective. Is just those people that have like post ACL, post osteoarthritis, or just arthritis in general, knee replacements, a lot of that, where when the knee goes over the toes, it does put a little bit more stress on the knees. Okay, healthy knees, which hopefully you have, there's no problem with that. But a lot of people in rehab settings, they don't want the knees go over the toes, just because that's a lot less pressure in the knees. If you have a lot of knee problems, okay, or you're slowly getting used to doing squats from not doing it over time, this may be a good starting point. Okay, bodyweight squats, I'm just holding on to something that's just out of the screen. Okay, I can put all my weight back. I can get into a deeper squat. Okay, if I have a lot of problems, I can use my arms to kind of help me get up if need be, which is kind of nice. And I can slowly work into more having knees over toes as I slowly get used to things, and then transitioning with weights and so forth. But that is the main reason why some people say yes, knees should, and why knees shouldn't go over toes. Okay. Ankle mobility is really important for a lot of these things. This is going to go on my whole squat spiel. So without ankle mobility, your knees can get over toes, which a lot of people have this problem. Really, it's lack of tightness in your gastrocnemius, your soleus, or just general like adhesions in the joint where you can't move from inactivity and injury and stuff like that. Go. I'm talking. Go, Kenny. Go. It's dead. Go. Okay. Kid interruption. Sorry. So work on flexibility of like your gastrocnemius and your soleus, just normal gap flexibility. There's a lot of ways to do that, which I'm not going to get into in this class. But let's say you don't have all that, let me just kind of dabble to demonstrate where my back is. If you don't have a lot of flexibility in your ankles, what happens is that's where you get to bend over more during a squat. Okay, so ideally I want this bar on my back and my shins, my tib and fib, okay, to be parallel as I squat. Okay, that's the ideal thing. But when you lack the ankle mobility, what happens is you tend to bend over more, where now my back, where the dowel is, and my shins are not parallel. It does place more stress on the back the more bent over you get, which can be a bad thing. Some of it's good, some of it's bad, but usually it's not ideal overall. Usually you want your back straight, so you squat. You don't want the arching this way, or the excessive lumbar and thoracic extension like this. One thing that drives me crazy, especially how I was taught initially, which is wrong, a lot of people still taught that, is to look up at the ceiling. So like, hey, let's look up here. When we squat, they keep our chest up. Okay, that teaches a lot of bad mechanics as we squat, because as we're squatting now, we're trying to look up, and we tend to arch our backs more. Okay, when it just needs to be straight. Okay, I like looking straight ahead and not like slightly down, because I like keeping my cervical spine in line with the rest of my thoracic and lumbar. Okay, so as I squat down, okay, it's all straight and secure as I do it. But the whole looking up, I think that was maybe initially a good teaching tool, but not really good for mechanics. Oh, what other common things with a squat, especially on this assignment? Okay. Oh, hamstrings are not a primary factor, probably a primary mover in the squat. Okay, they are a secondary mover. Okay, so ideally it is quadriceps femoris. Okay, which is rectus femoris, vastus medialis, lateralis, and vastus intermedialis, which are deeper. Okay, and then your gluteus maximus, which is your prime movers. Okay, hamstring is a secondary mover. Okay, because the hamstring does hip extension and knee flexion with that. Okay, your adductor magnus, okay, or your adductors in general, but the adductor magnus, which is one of your hamstring muscles deep in there, which sits kind of posterior on your adductors, does have a little bit of a hamstring component to it, so that's why you may see that listed as a few places, because it does help you kind of extend a little bit. Okay, your gastrocnemius and your soleus are also important muscles for this, because your gastrocnemius, okay, your calf muscle, okay, is a two joint muscle. It does pass the ankle, okay, and the knee, okay, because it attaches up here on the distal femur. Okay, so those help with extension, controlling eccentric and concentric motions of the knee, okay, along with the ankle as we're pushing up. Those are the most commonly missed things this week. I'm trying to think of anything else off the top of my head. But make sure you guys pay attention to a lot of the questions, especially how I ask them. Some people just forgot to answer some questions, or they maybe started and didn't finish them, like the original insertion of the gluteus maximus. But pay attention, we will do some more. All right, see you guys soon.